Hi all. So I'm going to start something new in terms of a video series. It's Dr. Lisa. I am an acupuncturist specializing in fertility. And one of the things that I have access to is as a member of the ASRM, the American Society for Reproductive Medicine, I get daily emails indicating or linking me to various research articles that have been released in regards to issues of fertility. Often the articles are very technical and not particularly related to what I can do as a fertility acupuncturist. And yet, at least twice a week, I run across an article that actually has specific relevance to both my practice and things that my patients are doing. So I thought one of the things that I could do is actually create a series of videos talking about articles that are relevant to women who are trying to get pregnant. The one that I wanted to start out with is something that I have only recently learned about. And let me give you a little bit of background. About 5 months ago, I started working with a patient who has a history of severe anemia. And there was another patient that I started working with about 7 months ago who also has a history of reasonable red blood cell levels, but also very, very low ferritin. And ferritin, in case you aren't familiar with it, is a measure of how much storage or iron that you have in storage. The reason that iron is really important as an indicator or in fertility is that you make red blood cells using iron. And if you don't have enough iron, you can't make enough red blood cells. And anybody who knows anything about fertility knows that blood is the name of the game. You need blood to bring all those good nutrients down to your ovaries to create a good thick uterine lining. And if you don't have enough red blood cells, then it's going to compromise fertility. It's difficult to measure this sometimes because every woman is individual. But what I find in my clinical practice is that women who have sort of low normal levels of red blood cells, or as it turns out, very low levels of ferritin actually have trouble getting pregnant. And the reason that this is important to understand is because ferritin isn't something that most OBGYNs or GPs actually measure. When you get a CBC, which is a complete blood count, they will look at the number of red blood cells that you have. And if that's normal, then they'll say, okay, you are good to go. But what is interesting is that one of the articles that I read recently, and also based on my experience with my patients, low levels of ferritin can be an indicator of trouble getting pregnant. So what I wanted to do was refer you to this article because in particular, this study was looking at, and the name of the study is Serum ferritin level is inversely related to number of previous pregnancy losses in women with recurrent pregnancy loss. Now, what that translates into is this group of researchers looked into how the level of serum ferritin was related to repeated pregnancy loss. Now, remember, in research, they always ask a fairly narrow research question so that they can actually determine, what is going on with the particular factor that they're studying. So in this particular case, they were looking at, does ferritin level have anything to do with repeat pregnancy loss? And as it turns out, the answer is yes. The conclusion was that the inverse relationship, so what that means is the lower the ferritin level, the higher the rate of repeat pregnancy loss. It suggests that low ferritin is associated with more severe reproductive disturbances in women with repeated pregnancy loss. Now, whether or not, what this study says is that whether or not low ferritin is related to repeat pregnancy loss, or they could benefit from iron supplementation, is something that they need to study further because they weren't specifically looking at that. But based on my clinical experience, one of the things that I have my patients do is basal body temperature chart. And I have noticed that my women who have, when I started looking at their ferritin levels, women who have lower ferritin levels often have a basal body temperature chart that doesn't get up into the ideal range of temperature that I want to see it at. They also tend to have slightly shorter periods. Well, periods are a really easy way for you to measure whether or not you have, to a certain extent, whether or not you have enough blood flow going down to your uterine area. So if I have a woman who has low ferritin levels and also has short periods, and her BBT is lower than I want it to be, then what that tells me is that she doesn't have enough iron stores. And generally what I do is supplement. And this is even if her red blood cell count is in the normal range. Because remember, all that shows you is when they stick a needle into your arm and they withdraw blood, how much red blood is in there. But it doesn't really measure what's going on down in the uterus, because the blood that goes down to the uterus and creates uterine lining and is feeding the follicles is kind of sequestered. How it flows in the body is not really a well understood mechanism, and you're sure not going to be able to figure it out from bleeding into a tube. That's why I look at the basal body temperature chart, and I look at how long the period is, and then as I've discovered and started doing, I look at the ferritin levels. So today's conclusion is, if you are having pregnancy issues, it might be useful when you get blood work done to not only check your red blood cell level, but also check your ferritin level. And if it's lower than 60, then what you probably want to do is consider some supplementation. If it's lower than 40, then it absolutely is affecting your ability to get pregnant. In terms of the study, what it means is if you have a history of repeat pregnancy loss, then you absolutely need to get your ferritin levels checked, because it makes sense that if you do not have enough blood circulating down to the uterus to create a good healthy placenta and nourish the baby, that you are going to have lower iron stores, either whether that's the cause or the result of your body desperately trying to create more blood, we don't know. But it's a useful, objective, measurable test that you can take to start to unravel the mystery of what's going on if you have a history of repeat pregnancy loss. And also, if you are trying to get pregnant and you have low ferritin levels, making sure that your prenatal contains adequate stores of iron, making sure that you're eating iron-rich foods, and potentially, if it's really low or you have anemia, making sure that you're taking an iron supplement is a really good thing to help with fertility. I'm looking forward to continuing this series of videos, and I will see you soon.